Hello everyone, this is Dr. Agalya. We are going to see pelvis part 2, where we are going to discuss about the various types of pelvis, the difference between the male pelvis, female pelvis and the anomalies in pelvis, right? Now pelvis is classified into 4 different shapes. Pelvis is classified according to the Caldwell-Molloy classification into 4 types. The 4 types of pelvis include the gynecoid pelvis, android pelvis, anthropoid pelvis and the platypeloid type. Among this, gynecoid pelvis is the most common one, where we can find in 50% of the people. Android pelvis is seen in 20% and anthropoid pelvis is seen in 5%, 25% and platypeloid pelvis is seen in 5%. So, this is the images representation of the 4 types of pelvis. If we see gynecoid pelvis, you are able to see the gynecoid pelvis is a round shaped pelvis, whereas the anthroid pelvis is a heartin shaped pelvis. The anthropoid pelvis is an oval pelvis, but it is anteroposteriorly oval. Platypeloid pelvis is transversely oval pelvis. Okay. Now we will see the difference between these 4 types of pelvis, right? So first comes the gynecoid, next comes the android, then anthropoid and platypeloid pelvis. Now, we have already seen how will be the general representation of this gynecoid pelvis. It is round in shape, whereas android pelvis is a heart-shaped pelvis. Anthropoid pelvis is again AP, that is anteroposteriorly oval. Okay, whereas platypeloid pelvis is a transversely oval pelvis. So, this is anteroposteriorly oval and this is transversely oval. Now, coming to the pelvis inlet. If we take the inlet, again we have to see the how is the transverse diameter, how is the anteroposterior diameter. So, if we take the transverse diameter, we will see only the important points. In the transverse diameter, if we take, so it is narrowest in the android pelvis and anteroposterior diameter is wide in android pelvis, but we know since the platypeloid pelvis is transversely oval, so the anteroposterior diameter becomes narrow here. Okay. Then we have something called as forepelvis. So, don't ask me, ma'am, you didn't teach what is forepelvis, because forepelvis is a part of inlet which is seen just before the transverse diameter. So, the part of the pelvis at the level of inlet seen before the, anterior to the transverse diameter is the forepelvis. If we take the forepelvis, it is wide in the gynecoid type, then narrow in the android type, then it is divergent in the anthropoid type, and in the platypeloid type it is straight. Coming to the cavity. In the cavity, we are going to see about the ischial spines. Ischial spines are most prominent in the android pelvis, whereas there is no such prominency seen in the other types. Then coming to the outlet, we have the subpubic arch, which is wide in the gynecoid and the platypeloid type, whereas it is narrow in the android type and it is medium in the anthropoid type. Same way, you have to see about the sacral angle. If you take the sacral angle, it is narrowest in the android type, whereas it is wider, that is more than 90 degree in the other three types. So generally, if a fetus is coming, how will be the fetal position in these types of pelvis? The fetal position in gynecoid type will be on occipito-transverse or occipito-anterior. In android also it will be occipito-transverse or occipito-anterior. In anthropoid pelvis, it is direct occipito-posterior mostly, and in platyploid pelvis, it is again occipito-transverse. So, if you see about the natural delivery, so how will be the prognosis of natural delivery in these types of pelvis? The prognosis is good in gynecoid pelvis and it is somewhat favorable in platyploid pelvis, whereas in case of android pelvis, there is much difficulty, and in case of anthropoid pelvis, it will lead to deep transverse arrest. Okay. Now coming to the difference between male pelvis and female pelvis. The first point, general appearance of male pelvis. General appearance of male pelvis is taller and narrower, whereas female pelvis is larger and broader. Generally, male pelvis is having a inlet with heart-shaped inlet, whereas in the female pelvis, it is oval or round inlet. Next point is about the cavity. In males, the cavity is long and is tapering, whereas in females, it is short and cylindrical. If we take the outlet, the female pelvis outlet is wide, whereas the male pelvis outlet is narrower. Then coming to the ischial tuberosities and ischial spine. So, this is general. We have seen the inlet, cavity, outlet. Coming to the ischial tuberosities and spine, in the males, it is prominent, whereas in the females, there is no such prominency seen. In the next one, we have to see about the arch. If we see the subpubic arch, generally in males, it is narrower, whereas in females, it is wider. Coming to the obturator foramen. Obturator foramen in males is oval, whereas in females, it is triangular. Next, about the acetabulum. In males, it is narrow and it is seen laterally, whereas the acetabulum in females is wide and seen facing medially. Okay, so this difference also we should know. Now coming to the female pelvis and male pelvis, like as we have already seen. So this is the male pelvis where the pubic arch angle is less, 60 to 70 degrees, whereas the pubic arch angle is more in female pelvis. And in males, the pelvis is having a deeper pelvic cavity, it is long and tapering, okay. Whereas in females, there is a shallow pelvic cavity and the anterior superior iliac spine or the ischial spines are usually not prominent in the female pelvis, whereas the ischial spines are the prominent in the male pelvis, okay. So this point you have to know. Now coming to the various types of pelvis. So generally, as we have learned about the different types of pelvis as well as the male and female pelvis, now you can come up with a conclusion like generally a gynecoid type of pelvis is a normal female pelvis, right? Then the android pelvis is a normal male type of pelvis. Then already we know that is the platypeloid pelvis is a transversely oval pelvis. Yes, it is a transversely oval pelvis. And anthropoid pelvis is a anteroposteriorly oval pelvis. From here itself we can pick up. It is anteroposteriorly oval. Okay, so anteroposteriorly oval, and again you can pick up the word OP here. Okay, so it is occipito-posterior position. So when there is occipito-posterior position, it will lead to deep transverse arrest. And in the next one, we have anomaly of pelvis that is called as Neeglis pelvis, where one ala of sacrum is absent. So this is a picture of Neeglis pelvis. See, we have, this is the ala of the sacrum. Here it is absent, right? It is not formed. So this is Neeglis pelvis, where one ala of sacrum is absent. Okay. Next one is Robert's pelvis, where both ala of sacrum are absent. Okay. So the next pelvis is contracted pelvis. So contracted pelvis can be constitutional or seen in any disease conditions where the diameters at various levels of the pelvis are reduced. Next comes rachitic pelvis. This is mostly seen in rickets and other disease conditions, especially vitamin D deficiency. Right? So with this we complete the topic pelvis. Until we meet in the next video, take care and keep learning.